Hi, my name is Nicole Tamby. Thank you for joining me today and allowing me to discuss my portfolio projects and, that I have submitted throughout my time here at Bryant Stratton. These projects have allowed me to meet the institutional and program outcomes for my medical coding and reimbursement program. So I have my MedCred portfolio up, and I am under my educational background. And under each outcome, I have attached a project that I have done throughout each course that have allowed me to meet the outcomes. The first project, the first outcome would be the institutional outcomes that I've met for information literacy and communication. And for this outcome, I chose one of my projects from my research and writing program or course that I had taken. For my final research paper, I was able to utilize the Bryant and Stratton online library and also the Google Scholarly to obtain peer-reviewed and scholarly resources. And researching how medical fraud is being prevented by medical coders, providers, and other medical healthcare personnel. These resources did provide many facts about medical fraud and prevention, and it also allowed me to clarify the policy and procedures that take place for fraud prevention in writing. So it did give me knowledge. So when I do go into medical coding workplace, I'm able to understand procedures that take place to prevent this fraud from happening. It was one of the outcomes that I do choose, or one of the projects that I did choose for that outcome. The next project that I chose, this was also another research and writing. This was research and writing for the workplace actually, and this was for relational learning outcome. For transferring knowledge, skills, and behaviors acquired through formal and informal learning and life experience to new situations. And for this outcome, this project did allow me to reflect on skills and knowledge I had acquired throughout my lectures. I learned importance of brainstorming and looping in the relevant information before starting an essay. Learned about how to outline my paper and how crucial the rubric guideline is because it helps set the tone of the essay and how to deliver it as well. I learned that utilizing the reading aloud skill also helps with the tone of the essay and what information to keep and the information to discard. The next outcome, I did choose a project for my career development theory and practice, and this helped me to meet my thinking abilities outcome. So to employ strategies, um, for reflection on learning and practice in order to adjust learning process for continual improvement. So this reflection allowed me to reflect on being career ready. I was able to discuss my skills in improving my resume and developing an online presence that would showcase my skills and relate to others who are in the medical coding field. This reflection allowed me to understand the importance of being organized with my resume, cover letter, and portfolio when attending an interview for my future career as a medical coder. So it's preparing me for when I go in for my medical coding interviews, which I am definitely grateful for. And I will be utilizing career services as well to tweak my resume a little bit more or help me to. But this project did help me to tweak my resume on my own and to help me understand what information is relevant to put in the essay as well. So the next outcome I did meet from was the quantitative and scientific reasoning, and I chose a project, my portfolio project from human disease and drug pharmacology course. So this was helped me to the first outcome I have in here. for follow established methods of inquiry and mathematical reasoning to form conclusions and make decisions. So this portfolio project allowed me to understand specific labs such as urinalysis lab and the signs and symptoms each patient was experiencing based off the medication they were taking. I gained knowledge of the appropriate medication dosages that would allow me to code the correct diagnosis for a patient taking too much of their medications or too little of their medications. So it gave me more of an understanding on how they come up with the dose for the patient, and if the patient is getting too much of that medication or too little of their reactions, their on how the patient reacts to the medication, and also within their labs showing the toxicity of each medication that's given to them. The next institutional outcome project I chose was another one from research and writing. This is for the community and career. And for this one, I'm just going to bring it down to the correct one. Okay. So research and writing. There it is. And this was from this paper allowed me to understand, learn the importance of staying in compliance and following the rules and regulations to prevent medical fraud once I am in a professional healthcare coding and reimbursement setting. So it's very similar to the first outcome that I had met, which was the information literacy and communication. So it helped me to have a better understanding of how fraud takes place in the facilities, and how we are, as medical coders or any type of healthcare personnel, are able to prevent it from happening, and also who we are able to notify along the way if we do witness any fraud or any fraudulent activity within the workplace. I'm next going to be going into my program outcomes. The first one would be to demonstrate competency to assemble, process, maintain, store, abstract, analyze, index, and retrieve health information data. The project I chose was from evaluation and management services course. So this project allowed me to demonstrate my understanding of the CPT coding system. I was able to follow the CPT coding guidelines for evaluation and management codes to properly code the health information data given within the scenarios. So this gave me a better understanding on how to work with CPT codes and how to code the scenarios correctly by the diagnosis and the procedures that were performed in each scenario. The next program outcome that I did meet, this is going to be analyze the results of coded data to ensure medical necessity is met when auditing charts. So this is going to be up here. This is the electronic health records course. I chose a project from the electronic health records course that I had taken. In this project, I explained the importance of submitting data correctly within the EHR, which is electronic health record. It is important to submit accurate data and patient information because it does prevent claim denials or making mistakes with patients, such as giving them the wrong prescriptions, diagnoses, and procedures that are not medically necessary for the patient. So this project did allow me to have a better understanding of what medical necessity means for a patient, and why some procedures are not medically necessary. They need to have the correct clinical documentation to back up the necessity for each patient that is getting these procedures. So it's just basically stating that how I need to accurately submit claims with the correct data and patient information so that the claims do not deny for the patient or the facility. The next program outcome that I had met was to abstract information from medical charts to assign the correct diagnosis, which is the ICD-10, the procedure, which is CPT codes, and the supplies, which is the HCPCS Level 2 code in a variety of medical situations. So the portfolio project I chose was for my advanced CPT and HCPCS 2 coding course. This project allowed me to analyze provider documentation within the patient's charts and assign the appropriate procedure, diagnoses, and supply codes. After I coded each scenario, I was able to reflect on how I reached each code for each procedure, diagnosis, and supply mentioned. So this project gave me a better understanding on how to read and how to analyze the provider's information so I can code each scenario correctly with the appropriate CPT codes, ICD-10 codes, and HCPCS codes. And the last program outcome that I had met with one of my portfolio projects was the evaluate the accuracy and completeness of the patient record as defined by policy, external regulations, and standards. And that's going to be down here. Make sure you see that I've met that outcome. There it is. And I chose a portfolio project from my clinical documentation, integrity, and quality course that I had taken. So this project allowed me to explain the importance of high quality documentation. High quality documentation can prevent external audits from taking place and could provide a better quality of care to the patients. I explained the 7 characteristics for a complete patient record, such as legible, reliable, precise, and accurate information, consistent clarification, and timeliness. So this showed me the importance of how to what high quality documentation is and how it is needed and how we are able to query providers so as a medical coder we can get this high quality documentation so that we can code to the highest specificity of what's needed on each claim, for each diagnosis and for each procedure, so that we can get reimbursed, so the doctors are able to be reimbursed, and so that claims are not being denied and patients aren't not paying out of pocket or not receiving services that are not medically necessary. So that concludes my course outcomes. That it concludes my institutional outcomes and my program outcomes that I have met throughout my time here at Brighton Stratton. So I'd like to thank you for allowing me to explain each outcome to you and what project I had used. Thank you so much. Have a good day.